Hello. I see some people are starting to come in. As you come in, I would love it if you tell me who you are, where you're from. We're going to start in 3 minutes. Let me know if you have any questions throughout the lesson today. You can write it on chat. Okay, so we'll be starting in just 2 minutes. I see people are coming in. So happy. Hi, Peter. Hi, Maria. Beatrice. Danielle. Hello, hello. This is so exciting. Okay, we'll be starting just in a minute, so we can let more people join us. They're still joining. Great, so it's 8 o'clock. Hello, everybody. Welcome to the Quantum Friday Spotlight. I'm so happy to be with you today, and thank you for joining us. Today, we'll be talking about phobias and increasing self-confidence. Okay, as I said, during our previous lesson, I want you to understand that working with a client, there's so many ways in working with a client, and it's the uniqueness of each situation and client. So I don't want to confuse you if you have been taught in any different way. These are just different approaches, and nothing is incorrect. Everything is correct. Okay. There are infinite possibilities. We all know that. So phobias. Phobias and past traumas are built and carried in our conscious minds, but also in our subconscious minds, all contributing to the issues people are facing and why they have come to you. Whatever their issues are, I think we should always have a few sessions on their phobias, because this will help them lighten the weight of your client and help them deal with their today and their issues. So what exactly is a phobia? A phobia is an extreme or irrational fear, or it can be an aversion to something. Aversion meaning a strong dislike or a disinclination to something. Okay, the impact of a phobia can range from being annoyed, causing anxiety, physical tension, mental stressors, adrenal fatigue, to other more serious complications which can be severely disabling. They can be little phobias or one huge phobia attributing to an issue that they've come to you about. People with phobias often realize that their fear is irrational, but they can't do anything about it. It's over their power. Okay. Phobias can interfere with their work, their school, their personal relationships. Some examples that can trigger phobias are some kind of distressing events, such as drowning, accidents, or anything life-threatening. Exposure to confined spaces, extreme heights, animals, or insect bites. People with ongoing medical conditions or health concerns often have phobia, and that's what we see a lot in these days that we're living with the COVID. There's a high incidence of people developing phobias after traumatic brain injuries from accidents, stroke, or epilepsy. Substance abuse and depression are also connected to phobias. People with genetic predisposition to anxiety may be at high risk for phobias. Age, socioeconomic status, and gender seem to be a risk factor as well. For example, women are more likely to have animal phobias. Children or people with low socioeconomic status are more likely to have social phobias. And men make up the majority of dentist or doctor phobias. This is statistics. The most common and disabling symptom of a phobia is a panic attack. Okay, some symptoms of a panic attack we all know is a pounding and racing of the heart, shortness of breath, upset stomach, nausea, elevated blood pressure, trembling or shaking, chest pain, choking sensation, dizziness or lightheadedness, profuse sweating, or a sense of impending doom. Regardless if a person experiences panic attacks, everyone has underlying types of phobias, traumas, or shocks that they may either block them energetically or lead them to their health issues, lack of confidence, stress, etc. Therefore, you should address them at some point, as I said earlier. A good idea is planning a 3-session approach to relieve the client of these issues and giving you the time from session to session to work on it from different perspectives. In phobia, the areas of the brain that deal with fear and stress keeps retrieving the frightened event inappropriately. Researchers have found that phobias are often linked to the amygdala, which lies behind the pituitary gland in the brain. The amygdala can trigger the release of fight or flight hormones. These put the body and mind in a highly alert and stressed state. So having this in mind, you can consider balancing these hormones through the amygdala, okay, through the device. Many people go for counseling when dealing with phobia, which of course is very helpful. However, through our quantum biofeedback device, it has amazing and very effective therapies to address deep-rooted phobias, and of course, very effectively and quickly. More quickly than just through psychotherapy. Of course, many people do it complementary. People come to me when they're dealing with phobias and they go back to the psychotherapist with all their information from the device and the reactions, emotional issues coming up, etc., and they talk with their psychotherapist. Okay. Some people also may need some medication, so you may want to cooperate with your doctor. But our device is very effective, as I said previously, and the majority of cases are addressed successfully. So the number of therapies needed depend on the uniqueness of the case, anything between 1 and 4 sessions, but I think 3 is the magic session, the magic number. After the first after the first session, though, they see the panic attacks are practically gone from the first session. But they may need 2 or 3 sessions more just to back it up and go deeper. Mm-hmm. So, as I said, there are many ways to work, and there are infinite possibilities. I'm just giving you some examples today. So let's start with our amazing device. Let me share my screen with you. Hi, everyone again. I see all the chats coming in. So share the screen. Okay. Oh. Okay. So for our purposes, I've already I've already calibrated, tested, and let's say I've already done my startup method of warming up my client. Remember, we always want to start up our client, warm them up, relax them, and then go into our main focus of our therapy, which will be phobias today. Also, something very, very important every time we do our therapies, remember, I personally don't use protocols. There's a general guideline that we use, and we can set out what we do, let's say for phobias or any other kind of focus that we want to have. But each time we go into the session, we do want to see what comes up, what reactions come up after testing. We're peeling the onion, remember. So, and everybody is unique. So the first thing that we'd like to do is check our shaping function. This is our reaction to love by default. So here it shows us 70%. So we want to monitor this, how it's going from session to session and within our session. Reaction to love. Okay, the next thing that we want to monitor and see, give us some more information, are the causes and aggravation chart. This is very interesting. Aggravations, I see anything over 100 related to, let's say, the phobias that I want to work on. Over intellectualization, too much thinking, too much on our mind. So we want to have a clarity of mind. We want to do a lot of brainwave training here, super learning, clear the mind. Karma, dealing with the past trauma. Interesting, since we want to do with the phobias today, and struggle with self. So we want to work with the conflicts. So this, I always like, as I said in our previous lesson, to do our print screens and keep a report. Very important, but it's also for us to refer to. I copy paste on the Word document. Let's go into causes as well. Again here, over intellectualization, desire, stress, that's 78. Okay, so I'm looking anything over 100 that pertains to our issue. Okay, so I keep that in mind too. I would copy and paste it in my Word document for later use. Okay, next I would go into the risk panel, the risk profile. Remember that the risk profile is connected also with a body viewer. So anything that we load here is also loaded onto our body viewer, and it's piggybacked and layered in throughout our whole therapy. So, okay, as usual, we would look into the top issues for risks. But here, for our lesson today, since we're talking about phobias, past traumas, etc., and anxiety, let's look at what pertains to that. Kidney, interesting, for fear. It's in chronic issues, stress, chronic. So I would like to load them. Sensory, interesting, neurological. Let's go further down. Emotional risk. Hormonal, remember the fight or flight through the amygdala. Hypoadrenia, adrenals, and cognition is the last one. That's the most chronic. Over intellectualization, just like the causes and aggravations said. So I've loaded them. Okay, for our purposes and for time saving, I won't treat them right now. Normally you would treat them. Okay, and I would close. Okay, so they're loaded also in the body viewer so we can piggyback it later. Now I want to go into my favorite panel that only we have. It's the phobia therapy panel. This is an incredible panel, has just about all the phobias here. I always like to do the unconscious search, see what subconsciously comes up. Now, a lot of these phobias may come up and they may seem strange, but remember what phobia is. Phobia is a deep fear, it's a deep-rooted fear. It also is an aversion, okay? But there's always a story to it. I totally trust what comes up in the subconscious. Even if a client says, no, I don't have this, you have to keep talking and see what the story is behind it, because for some reason it's coming up. Now, because some of these words may be unknown, but even if they are known, I always like to look in Google while I'm doing therapy. I would press treat right now, whatever comes up. And while it's doing the treating, I would look in Google and search Alurophobia. These are Greek words, so I know what they mean. Alurophobia, I think it's for rats. Let me see, though. No, it's a fear of cats, intense fear of cats. Panic, anxiety of cats. Now, feline cats. I love cats. I have 3 cats. But for some reason, they're not close to me, because I've put myself on here. I don't know what kind of deep-rooted thing is this with me. For some reason, it's coming up. Maybe I have to get unblocked, because I also have my dog, and I love my dog. For some reason, this came up. So, I always respect it. The next one, Photophobia. Let's see what that means. These are really, really interesting. And they always come up with a reason for it. I mean, banana therapy here, banana phobia. I've had the other day, a girl came up with banana phobia. The mother's like, why banana phobia? And she loves eating bananas. She eats bananas every day. And then she realized that actually, because this girl is severely disabled, and she really can't do anything. She feeds her banana. She loves her banana, but she always, for some reason, puts it on the side. And we realized probably she's scared of eating her banana, of choking, because she chokes easily. See, so even the mother realized it had information behind this. So, and by working this panel, we reduce the fear, and we reduce the dislike, let's say, of what the person may be going through. Some of them are really, really interesting. What was this one? Photophobia. Fear of hair. Excess, people with animal excess hair. Yeah, I don't like a lot of I don't like a lot of hairy. I'm scared of my hair falling. Maybe that's an issue. Of course, I've worked a lot with myself, and so I've had a lot of sessions. So maybe these aren't really serious issues that I have, but a person that you first started working on definitely come up with really serious issues. Photophobia. Okay, photophobia. It's obviously of light, fear of light. Let's see though, maybe something else comes up in the definition. You're not actually afraid of light, but you're sensitive to light, the photophobia. I could be. Yes, I could be. So definitely, I want to clear all of them by at least having 85%. Okay, so while these are working, I will put my piggybacks in the background. We have beautiful piggybacks here, the third eye stimulation, relaxing the client and working their third eye, pineal gland. Let's do an unconscious frequency search. Okay. Unlimited mind power. Interesting. So I would put start. So that's working piggyback and body view. Remember, we loaded the items in the risk profile. So it's loading. I definitely want to work on, since we're focusing on our phobias, what else? Phobia, definitely. Emotions, definitely. Defense mechanisms, anxiety. Load them all in and just let it run. Kidneys, definitely. Okay. Okay, so We have the body viewer running as a piggyback. We had our third eye stimulation, and this is running as well. Let's see how we're doing. And remember, we always want to do our print screens, have our file so we can refer back to. Let's see if we have any questions. Oh. Romania, fear of hair. Yeah, feel anything. Yeah. We have people from Toronto. Hello, London, Budapest. What do you recommend for pteronophobia? What's pteronophobia? Let me see. It's for, is that for birds? A fear of being tickled by feathers. Ooh, pteronophobia. Oh, no. Pteronophobia is from feathers, yeah. Maybe you were tickled too much, the pteronophobia. Just, I like working on these panels. I'll show you how I work. One moment. I will show you how I work, and you will see. You will see. Let me share my screen again. And come back here. Okay. So we've gone to 78%, 80%, and 58%. I would do it again and again and again till we have 85, at least 85%. Okay. After this, what I would go to is go to biofeedback, systemic relaxation, and release phobias. Going deeper into those phobias, because remember, we're layering in our therapy. So we worked on specific phobias, and now we're going to release them, release the phobias in the biofeedback systemic. Okay, so we would wait here till it goes to 100%. Okay, we have our other piggyback files running. I would also like to do disease dictionary and the anxiety there to reduce anxiety. Let that load. It takes a little bit of time because I have our camera running as well. So by the time it loads, it'll take a little time. Okay. We'll wait there. Okay, so for our purposes, let's say our rectification went to 100%. Okay, I would leave here. I would relax the mind after that. I would leave it to go to 100 again, the rectification. So again, if it's gone to 100, I would then also go to shock to layer in the therapy. It was, I think it's here, the shock therapy, there. So these three therapies, I think, are a must. And thereon, depending on the time that you have, you can do your unconscious choices. But working on these really, really help. Now, I've noticed with people having a lot of past traumas, let's say, or compulsive and have panic attacks, etc. I've noticed a lot of times under the unconscious choices, it comes up, of course, the psychic pain, it comes up the psychic attack, and it also comes up stabilizing speech. Now that part of the brain helps again for anxiety. So, sometimes you may think, why is this coming up? So I'm not going to do it. But for some reason it's coming up. And if you search and look for the reasons why that's coming up, everything always makes sense. Okay. So for our purposes, let's see what comes up. Remember, in the aggravations and the causes, karma was coming up. So I'm going to do karma, but I want to show you what I do with karma. First, I do something else and I come back here and do karma again. It's okay that we go back and forth. I don't want to confuse you, but I have a certain way of working. That's what I want to show you. So let's say unconscious choice. What else is coming up for unconscious choice? We can press this 3 times. Psychic pain, there you go. When we're layering in phobias, they always come up. Psychic pain, relaxed mind, we already did, great. And learning disability, that's interesting because remember what came up? Over-intellectualization. So learning disability is coming up so we can have clear mind, a clarity of mind. So we can be more focused. That's why it came up. So I'm going to do all of them. I already did the relaxed mind, so that means the psychic pain. Again, till 100. Isn't this interesting? Yeah, so the psychic pain. Okay, I'm going to come back for the karma because I want to show you something before. After this, I would go into the NLP program. Now, there are so many panels for phobia. We can work on so many things. I'm not going to show you, I'm not able to show you everything. I'm just showing you some things that are really interesting, a way of working. But, at the end, I'll go over other panels as well for you quickly. So from here, I would go into unconscious reactivity. Okay, let's see what comes up. As past trauma. The unconscious reactivity shows us our past trauma through our life. Emotional conflict with friends. Okay. Physical trauma, circulation and forgiveness, karma issue. Okay, so let's take a look at the path as well. Let's put psychological disease, I don't know. Disease path. Okay. The reason why I didn't do karma previously is because I like to do karma after I work with this. Why? Because when I do therapy, and when you do therapy on this panel, it kind of brings up the memories and past trauma to surface. Many of these traumas, the people won't even remember. But if you start digging, they'll start remembering because they've put it in their subconscious. Okay, so because we're bringing it up to surface for 2 or 3 days, they may be on edge, and because you don't want them on edge and you want them to feel good, I like to work after this panel on the karma. It makes them lighter. It makes them more forgiving. And then we'll end up with feel-good therapy. So that way, the next 3 days, they won't be on edge because of these memories. Okay, it's very, very important when you're working with this. So it's come up different ages. Of course, we always want to print screen so we remember. And I'll show you why we need to remember in a bit. We'll do a treat. Okay. Because we'll use some of this information that we get from here in the neuro-emotional conflicts that we're going to use as well for the working with the phobias. So we're layering in our therapy, and we're combining the information that we're getting as we go along. See, that's why you really can't say that you have a protocol for everybody, because everybody's different, whatever comes up. Everybody's unique. Okay, great. We had a rectification to 91. So, okay, of course, with this, when this comes up, you'll discuss it with your client, you know, what comes up, the ages, et cetera, et cetera. I'm just going through this kind of quickly with you. Expectations of the future are a blockage to the present. Remember, I'm overthinking. Maybe I'm overthinking because of our lesson today, and I want to remember everything that I need to tell you. But I think that's the issue. Okay, so let's go to do the karma that I told you before. Because after the unconscious reactivity, I like to do the karma. Now, there's two things that you need to do. And remember, for the karma, there's two therapies here on biofeedback systemic. Under additional, there is release karmic bonds. Okay, so by releasing karmic bonds, you're releasing them. You know, you're forgiving whatever you want to forgive. You're releasing anything that's holding you to that past trauma. Okay, it's a two-step process here. When you go to 100, we won't for our purpose, but you know, we wait till you go to a rectification of 100. You end it. And then you go here to relaxation, and you go to reprogram karma. I love this because you want to reprogram. You want a new karma in your life. You want new things, good things coming your way. Okay? And that way, the trauma that you've worked on from the unconscious reactivity won't bother them within the next 3 days. Okay, they won't, because they have noted people, if you're not careful with that, they may, you know, be tearful, they may be crying, they may be on edge, and you know, you want to take care of your client. You don't want that. So then you do our reprogram karma, and you wait till you get your rectification till 30. Okay, so since my issue was the over-intellectualization, what do I need to do? I need to work on my brain. Now, there's so many different places here you can do brainwave training, even from the biofeedback systemic. But I like to go here. First of all, I would go into the time therapies. Okay, enhanced learning. Click all the skills you want to enhance. Okay, this would clear your mind. It really helps clearing the mind. Okay, you can put 3 minutes, 5 minutes, 10 minutes. I'll just leave it on 1 minute, just so we can be really quick. And we'll wait till we get our rectification. We get our rectification down here. And of course, we want our rectification over 85. I remember in the phobia panel, I had a man that it came up the fear of bees, and he didn't remember, and he was like, "No, I'm not scared of bees." And while I was working on him, he remembered that 3 years old, a beehive fell on him. Okay. And it came up on the unconscious reactivity, a trauma at 3 years old. And that's when he remembered, oh my God, it was the beehive. So, and it was so interesting how the whole therapy was built around that, you know? And for some reason, we unblocked him. Okay, so we would do it again till our rectification is 85%. For our purposes, again, I won't do it. After I get a rectification over 85, I would do the eductor 1 super learning therapy, which is an AFE program. Remember, the AFE programs are deeper therapies, always. So that's why you'd always want to do this one as well. And of course, the GSDR and the NLP super learning are really, really good. They're really deep. Brainwave training, really, really good. Always depending on your time available. Okay. So again, I would wait till the rectification is 100 before I close. But for now, I'm going to close so I don't spend the time. I would close this and go to time therapies and always do. I love this. For now, I'm just putting 1 minute because save time. Stimulate intellect. That clears the mind. And because we're doing brainwave training, it's not only the intellectual, over-intellectualization that I needed to work on, but remember the amygdala. All this is working your entire brain. So we're also working the amygdala. So relaxing. By this time, your client's fast asleep, definitely, by working him this way. And of course, always do your unconscious hormone, definitely the hormone. For our purposes, the phobia, remember the amygdala, the fight or flight hormones, dealing with the fear. Okay, so I would also do that, not only the intellect. Oh, 96%, you see? So then I would do the hormone. I'm not going to do it now. I would definitely do the feel good. Feel good, definitely. I could also do the psychological, okay? These are important, okay? Now, and also depending on what other issue they have that's coming up, chronic fatigue, whatever. Okay, now from here, what my logic is, I've worked phobias. I went to the brain, okay, and I'm working downwards. Downwards meaning I'm going to go to the spinal. Even though the spinal is not coming up here as suggested for me to go, but I do want to do the spinal because the brain sends the frequencies down to the body through the spinal cord. So you'd want to do the spine and clear any foci, any energetic blockages there. You would do it over and over again, the test and treat trifecta energy flow till everything is corrected. I'm only going to do it once for everyone. Everyone, I'm sure, knows how to correct it. We do it till it's corrected, all of it. Oh, and the next point I'm going to share with you is really, really good. I love it. Okay, let me see what's come up. Okay, so there's a lot of things that we need to correct. We'll do it over and over again till everything is corrected. Usually it takes 4 or 5 times. Okay, the next one we're going to do is the neuro-emotional complex. Remember what I said before? I did one of the things, the unconscious reactivity. I saved the print screen because I needed the information. Also, I want other information. For the neuro-emotional complex, what negative emotion we need, let's go to the NLP and see what our top negative emotions are. From here, okay, lust, antagonism, awareness, observant, inadequacy. Okay, so I would copy paste them there. Here to the negative emotion. Don't forget, we're working and we're layering in phobias, phobia, trauma, fear, right? And always end with resistance to change or unconscious resistance to change. Unfortunately, everybody has some kind of resistance to change, and by putting that in, it helps reduce it, okay? Recall the last time you felt that way. Well, that's now. Here, I have this thing here for the camera. Relate attachments to the emotion. Remember in the unconscious reactivity here, what was the conflict? The conflict was emotional conflict with friends. So that's what I would put there, friends. Okay, recall the first time you felt that way. Okay, you can get that again from the emotional unconscious reactive. Well, let's say not in gestation, but 15 years old, let's say. Okay. We can put 15, or you can see what your client tells you. Okay. Negative physical feelings, panic. Panic. I don't know, hormonal, whatever the physical feelings are. Who must you forgive? Again, from the unconscious reactivity, friends. You can also put self and inner self. Good too. Help them find themselves, inner self. This will help them find themselves. Okay, so you can test and treat. And we do that, again, there's 2 levels that we have to work here. So this can be corrected. First of all, you want your love index double at least from your frustration index, the number. And also you want all of them, because it's going through the spinal, it's the neuro-emotional complex. You want all of the all your spine corrected. Again, let me show you. Again, it'll take about 4 or 5 times. But really, really important. Okay, so we're layering in. We've worked on the phobias, we've worked on the ages, we've worked on the mind, the hormones. And I'll tell you my next tidbit, which is really good. Okay, so you see the love index is only 64. We want the love index higher than the frustration index. Plus, we want all these items corrected, not just a few. So we do it again. I'm going to do it one more time. It's not going to be corrected because, again, I tell you, it needs 4 or 5 times at least, so it can be corrected. But it's very effective, this therapy. The neuro-emotional complex is, some people have even told me that, you know, if they don't do it, they feel that they haven't done it. They feel the difference. People, especially with long-term health issues. Oh, I remembered now. Also, people with phobias, and you know, these type of psychic attacks, and you know, panic attacks. They may have also sensory disorders as well, and that, depending on where that came up on the risk panel, you would also put that in. And the sensory therapy and disorders is also in the biofeedback systemic relaxation. You can also find that there. It's near the relaxed mind and stuff like that. So you see, again, it still needs work. Love index and frustration index. We need it at least double the frustration. So we need work here, and we need them all corrected. I'm not going to do it all now because I still have so much more to show you. But you understand what I mean. Okay. From here, I would go to the sports program. This is really good. The sports program is not only for sportsmen. It's for everybody. It's the athletes of life, okay, let's say. And we want to increase our self-confidence. With everything that we've done here, we want to feel better. We want to feel stronger. Warrior stimulation. This works wonders. It's not only for the athletes to be a warrior in their sports, but it's also for everybody, for children, for everybody who have low self-esteem. Warrior stimulation. I love it. Okay. Just so many things we can do. Infinite possibilities. Infinite. I just wanted to share with you some other these tidbits that maybe you haven't learned, that you haven't heard of. Okay, so where are we here? Okay. So the warrior stimulation doesn't give us a rectification number, so we can just do it once. That's okay, because we're doing so much either way. Is that spurt that we're giving them to increase their confidence. The next thing that's really, really important is the mind-body focus here. I would do that. I'm not going to do it now because time is running by and I have so much more to show you. Mind and body focus for 1 minute, definitely, because that helps their relax their mind, and it goes into their, it increases their awareness and how their body and their cell function. Mind and body focus is also very, very effective. Okay, from here, if you do everything, either way, this is one session. A lot of time has passed by. So you'd also want here, after the mind and body, to do the conflict, the emotional conflict with. Now, remember, in the unconscious reactivity, it came up for me, friends. So it's the game. Okay, I definitely want to do an overall reduction here, and then do the reduction, the start eductor sport frequency number 2 for the game. Okay, and we do this. Now, depending on what can come up, some people would be the self would come up, others the team. Okay, for here, it's the game. And of course, oops, I shut it down. Okay, of course, here, I would wait till the rectification is at 100. Okay, now, the thing that I want to share with you now is that there are, as I said before, it's at least 3 or 4 therapies, all the phobias, so you can do everything around the phobia. Obviously, in one session, you can't do everything. These are some new things that I wanted to share with you. Some other things that you can do when working with phobias is from the universal therapy. You would want to go to the subspace morphic trans, and you'd want to clear all their dimensions. This is very, very important, because phobias and past traumas, even from the whole life, even any trauma is embedded in the aura and the different dimensions that we have, and they're there, even though we don't remember them. So it's very important to clear the submorphic trans. We clear it all, so everything is clear. I won't do it now because we don't have much time. And also clearing the aura. Remember, we clear it from the body scan and phase therapy. Remember the scan all. You would do scan all, and you would clear everything from left, right, back, aura, and then you would go down here and you would do the cybernetic rectification, etc. And clearing the aura. These are also very important. So if you have time in that first session to do it, it's good to do it. Okay. Other things that you can do that are older therapies, and that I'm sure that you've learned already. I'm just going over them really quickly. Oops, not here. From the universal therapy, here is the NLP, mental NLP interface. Here we have phobia. Okay, so we can work phobias from here. We can put their symptoms, panic attacks, whatever, blood pressure, hormone, whatever. You can, whatever information that you have is good to put here. Okay. It's okay if you leave it blank, but the more information you put, the deeper you go into the therapy, and the more you make, the more awareness you create with your client. Okay. Of course, if they're sleeping at this point, you can't put much because you have to ask them what to put here. So it's okay to leave it also blank. It also works. Phobia from here. Other places that you can work phobia from here is you can put phobia in the primary disease, what issues that's created, their kidney issues or hormonal chronic fatigue, whatever, emotional blockage, phobia, aggression, etc. You can add to Schumann wave. You can put some kind of Rife generator, maybe 528. You put it to 3 minutes, 5 minutes, how much time you want, and you would start. So that way you can go into a deep therapy this way as well. What else? There's so many places that you could work these things. NLP, covert, love, covert. Again, maybe I just love the device. That's why. Covert thought pattern. I love it. You unblock their issues and you send them towards enlightenment. Okay. How I work this, the covert. You load their issues, their emotional blockages, on a social level, personal level, unconscious, self-secret, and transcendental secret level. You would work them one by one till they're over 85. Okay, one by one, you would work these emotions, and then you would load all the emotions down here on the white line, and you would do the AFE enlightenment. So see here, I went to 51%. 51% only on this one. So I would do it again until I get a rectification of 85. Once I get the 85, I would reset. I would go to the next one, betrayal. Again, till 85, reset, and so on. When I go over through all, I would load everything, all the emotions down on the white line by clicking on each one. Okay? And in this way, I would build the enlightenment and unblock all those emotions. And you would rectify it till you're over 100. I've noticed this program especially works within 2 or 3 days, and it really unblocks them. The next time they come, they tell you how good they feel. And I've had people come in only for this. They want like an hour on enlightenment and on this unblockage. It's really, really good. Let me see. I hope, you can even do past life therapies to unblock past traumas, hypnosis, dehypnosis, and the biofeedback systemic therapies. You can work through their homeopathic signatures, the homeopathy, the Bach flower essences. The list goes on of what you can do to release these phobias. Okay, but I wanted to share with you the top panels that we can work. And of course, I don't know if you know, but we can always also work with the main matrix. The main matrix is a wonderful tool to work with, and you can do therapies here, even in your own cocktails. Maybe at some point we'll have a lesson on that as well. Okay, so I know I've given you a lot of information, and I don't want to overwhelm you. Any questions you have, you can message me on Messenger, Viber, Skype, whatever. You find me. Ask Peter where you can find me. You can find me. And I'll try to answer whatever I can for you. We'll be having our next lesson in 2 weeks again. I hope everybody enjoyed our night tonight. Thank you. Remember, when we finish our therapy, especially with these type of phobia therapies, finish with a feel-good therapy from the AutoZap. Yeah, I want them to feel good. Feel good when they leave. Where's the feel good? Here it is. Feel good. Yeah. Okay, thank you so much. Let me see if I have any questions here pending. The fear of overthinking, yeah. The fear of overthinking. I was overthinking for our lesson today. That's why. It is quite complex. I understand it couldn't be overwhelming, but our video is going to be on YouTube channel, so you can see it again and again as many times, so you can, if you've lost me somewhere. Thank you so much. Lots of kisses. Bye.